Imagine that on a journey through India, you witness the spectacle of a young man whose tongue and cheeks have been pierced with large bamboo needles. Yet there is no bleeding and the man feels no pain. Such a spectacle has been recorded on film and documented in National Geographic. The young man in the photo was a Hindu adept who at the time had achieved a state of consciousness that allowed him to mentally control his bodily functions. While some suggest that meditation can actually restore the body to optimal health, there is as yet no scientific basis for this. However, mesothelioma and other cancer patients have successfully used meditation techniques to control the symptoms of the disease as well as the side effects of treatment. Anecdotal evidence suggests that practitioners of Eastern religions can control their heart rate and even take poisons without suffering any effects through the art of meditation. It has been suggested that similar meditation techniques were once part of the Western Abrahamic traditions during the early and high Middle Ages as well. Several forms of Christian mysticism were prevalent at the time, and such mysticism, of which meditation is a large component, remains an element of Hasidic and Kabbalic Judaism and Sufi Islam to the present day. Meditation is defined as mental focus on a single point of reference, or none at all. The Buddhist concept of non-being. An entry on the topic at Wikipedia describes no less than 15 different forms of meditation associated with virtually every major religious faith on the planet. Whether it is a religious practice or one of the several secular forms of meditation developed in recent decades, such as biofeedback or autogenic training, all forms of meditative practice have the same components: deep relaxation, highly focused concentration, altered state of consciousness, suspension of left brain functions, high and sustained levels of self-awareness. There have been numerous medical studies into the physiological effects of meditation techniques. Such techniques are now actually part of mainstream medicine as a way for patients to deal with the pain without resorting to medication. Of greater interest to cancer patients is a 30-year-old report that was originally published in the Medical Journal of Australia, in which author Ainsley Meres documented cases in which tumors began a degree of regression after periods of deep meditation. In general, meditation is one of the most effective ways known for relaxing the body, strengthening the immune system, and altering one's consciousness. Those who seek to alter their consciousness by way of drugs and hallucinogenic substances are essentially taking a shortcut. Aside from the chemical effects on the physiology of brain and body, these shortcuts take the user to a level of consciousness for which they are frequently ill-prepared. Traditional meditation techniques take time to learn, allowing the subject to become acclimated to these higher levels of consciousness. In addition, there are no harmful physiological side effects and no monetary costs involved. The observations of Ainsley Meres notwithstanding, it is important for mesothelioma patients to continue with all conventional therapies as prescribed by their oncologists. Patients who are considering meditation should consider speaking with a fellow patient who has or is currently using meditation techniques. This said, meditation, like all CAM therapies, is not a substitute for conventional treatment. Nonetheless, it has been shown to be an effective supplement for such treatments. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist,
or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net, information and help for patients and families.